Swadikap and good afternoon once again. Today is Monday, the 15th of February 2021, and welcome back from the long weekend, long holiday that we had for 3 days. Just now, I hope you had a very enjoyable Chinese New Year and Valentine's Day, a long weekend. Of course, we came out with all the measures for you to enjoy the long holiday in terms of new normal practice and taking care of each other's health. So hope that was practiced. So first of all, thank you very much to Dr. Bird, Dr. Apisamai for the Thai language edition of the summary that we had just now. So today I have some information regarding the case regarding the new South African variant, as well as the measures that we have put in place to prevent the spread of that particular variant. But first of all, one important point that was mentioned in the Thai language briefing just now was regarding the issue of stigmatization. Of course, we've been having certain reports and news about certain marketplaces, certain provinces like Samut Sakhon, including certain people of certain nationalities in Thailand who have been at high risk, as well as those coming from abroad as well. So it's very important that we have been stressing all along that stigmatization is something that we have to be very careful of. We should not stigmatize or discriminate, because COVID does not discriminate. COVID does not choose between who you are, what nationality you are, what profession you are. So therefore, it would be kind of senseless if you see a market vendor, for example, and learn that he or she had been a market vendor in a particular province, or someone from a particular nationality, and you act as if that person is already COVID positive, which might not be the case. And a reminder that COVID is curable. It's curable because of the medical system and the treatment protocol that we have, and the quarantine protocol that we have. So therefore, we would like to avoid that sense of stigmatization and discrimination in Thailand altogether. So moving on first to the general situation and the number of cases that we have for today. We have recorded for today 143 new confirmed cases, as you can see on screen in the left-hand blue box. Out of 143, we have 68 cases which are from active case finding, and 11 cases of that number from traveling from abroad and who have been placed directly into the state quarantine system. 143 confirmed cases reported for today. But new recoveries far exceeds that. We have 772 new recoveries recorded for today. So as you can see, the numbers are getting better, quite more manageable. That is because of the active case finding acceleration weeks that we have had in the past weeks. And then we've scaled it down a bit currently. But still, of course, we've been able to identify most of the positive cases in particular areas through active case finding, which is very, very good news. So more recoveries now than the new confirmed cases. Total cumulative since last year, over 24,000, and total recoveries and discharged cases since last year, 22,000. You see now that the numbers are closing up, are starting to meet, which is very good news. Active cases still being under treatment in hospital, is now only 1,749. I say only because in the past weeks or days, it was as high as, if you recall, 5, 6, or 7,000. It was quite high. The gap was higher. So now the gap is closing in, which is very good news. But unfortunately, we have news which is not so good, some bad news as well, because we have 2 new fatalities recorded for today in Thailand, making the cumulative number of fatalities from COVID in Thailand today standing at 82. The 2 new cases of fatality are as follows. First is a 62-year-old Thai male, Thai national, from Ubon Ratchathani province with diabetes and chronic kidney disease as the underlying illnesses. And the second fatality is a 78-year-old Thai national, male also, from Samut Sakhon province with underlying illnesses of asthma and high blood pressure. So before going to the South African variant, I'd like to touch on the new cluster in Pathum Thani, which Dr. Apisama had mentioned just now. The CCSA and the Ministry of Public Health is now focusing on Pathum Thani province as a new cluster of cases that have been found in fresh markets, open air fresh markets. And the Ministry of Public Health has found over 200 infected persons in Pathum Thani, not in one day, in one duration, who are related to fresh markets or have visited fresh markets in that particular province, which prompted the provincial administration to order the temporary closure of related markets. And more testing is now provided to vendors and customers of that market. From the examination from the Health Ministry, it was noticed that the markets have low ceiling. The ceilings of the markets was quite low, so therefore inadequate ventilation system, which helped in spreading the virus and caused some vendors not to wear face masks at time due to discomfort because of the heat, well, because of the low ceiling and the structure of the market building. And as you recall, some days ago I had mentioned about one of the precautions is to have ample ventilation space and not to be in an area which is of closed ventilation for over 15 minutes. That would sort of serve as be a risk for the spread of COVID. So the Public Health Ministry had advised all the fresh market vendors and customers to strictly practice and disease control measures. Anyone who had recently had close contact with market vendors in Pathum Thani province is advised to seek medical attention or call 1422. This is the hotline if they are concerned that they have been infected. Now moving on to the South African variant, we address this because it's a new variant that is found in Africa and in spreading in countries in Europe, Australia, and the United States as well. There is this news on this variant in Thailand. So just to confirm that right now, there is only one confirmed case of this new variant in Thailand, who is a Thai returnee from Tanzania. So a Thai person who had been visiting Tanzania and returned to Thailand. This particular person arrived in Thailand on the 29th of January 2021 and had been tested positive in early February. You have an infographic there on screen for you. Just a bit more detail on this case. This Thai national is 41-year-old, is a gems trader, and had visited a gathering or a party, so to speak, while he was visiting Africa. And the participants of that gathering or party were not wearing masks. Now, this particular person also traveled in the course of his journey, traveled from Thailand through Ethiopia, the country of Ethiopia, before going to Tanzania. Now, on the 3rd of February, he was tested positive, and in due course, he was taken to the Emergency Infectious Diseases Unit, or EID unit, of the Thai Red Cross. So we'd like to reassure that this patient was staying in a state quarantine when he returned to Thailand and is currently being treated. There was no contact between the patient and any member of the public. All medical staff at the hospital and the quarantine facility have also been tested, and the results have returned all negative. The Disease Control Department is closely monitoring the situation of the new variants found in other countries and would take precautionary measures by conducting genetic analysis of the virus found in patients arrived from countries with report of new variant infection. If you recall, there are a number of variants popping up around the world, and stricter screening process for passengers from these countries had already been made in the case for Thailand. the persons who are tested positive with the new variant will also be required to remain in quarantine for more than 14 days, so for 21 days. So these are the measures and precautions that we are preparing for this particular new variant. Another piece of information is about just to update about the migrant workers registration, because we had talked about this a few weeks ago and the deadline had already closed. The Labor Ministry reported that more than 650,000 migrant workers have registered with the Labor Ministry's Employment Department to obtain legal work permits. And the online registration opened from the 15th of January to the 13th of February to allow migrant workers, including those who are of illegal status, to remain legally in the country if they complete the process. The number of registered migrants exceeded the expectation of the Labor Ministry. Actually, they had expected only 500,000 who would follow the process. And all these registered workers are required to take the COVID test and buy health insurance through their employers, and to ensure that those found infected will receive medical treatment and prevent further spread of the virus. They were also requested to report to immigration officials as per procedure for collection of biometrics by the 16th of April 2021. So just in summary, we have saw many numbers and statistics on screen in the Thai language edition, but in general right now the situation seems to be getting better. First of all, globally, in many of the countries you see on top of the list have actually been having lower numbers in the past days. Perhaps because of the availability of vaccines in many countries, the start of that process, as well as, of course, in Thailand, the numbers have been getting more stable and lower because of the active case finding mission success that we have had and the control measures, and of course, with your good cooperation. We hope that during the long weekend, we hope that no one had sort of breached, or no one had been lax or very unmindful and unaware of the importance of social distancing and DMHTT, and hope that, of course, you will be practicing all these measures continuously, even though it's on a long weekend, even though it's a weekday, even though next weekend and the next month ahead. And rest assured that we are doing everything in terms of the measures, in terms of the public relations campaign, in terms of the encouragement and the strict enforcement and everything, to ensure that Thailand will not be adversely affected, or our numbers will not get higher despite the continuing challenges, for example, the new variants that are coming up. So hopefully that will continue. We thank you very much for your cooperation. We had a very good long weekend. Our recommendations, our guidance are being heard to curb the spread in Thailand. Just to express that under the current circumstances, we appreciate very much your cooperation, the way you interact with your friends and family, the way you show your care and the way you show your love. Nevertheless, keep distancing and bear in mind you have to reduce possible risks at all times. Sharing love at a distance would be better for you and your loved ones at this moment and for our healthier future. So thank you very much for your attention, and we'll see you again tomorrow. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพันธ์